Very good. Okay, medical marijuana. In Michigan, we just passed the Medical Marijuana Act, and I think it followed suit with, I think, the first area that medical marijuana was actually legalized in was California, is that correct?
California, 1996.
Let's talk about that a little bit as far as what we're looking at as far as Medical Marijuana Act and who are the caregivers and how that works.
Certainly. Well, first of all, I want to clearly state there is no medical marijuana. There is no medicine in marijuana. There is one active ingredient in marijuana, tetrahydrocannabinol, or THC, which 30 years ago was isolated into a pharmaceutical drug called Marinol, and that's used for glaucoma and a few things like that. However, it's not very popular. The medical science doesn't use it as much as they do other drugs. When we come to the fact that in 1996, California was the first state to pass medical marijuana laws, we now have 14 states in the Union. Michigan is one of them. The provisions are very simple, that you have to be registered with the Department of Community Health. You must have a recommendation from a physician that you have some debilitating ailment that marijuana will assist with or help with. And that recommendation then allows that client or patient to have 2.5 ounces of marijuana. Now, in that same law, there's a provision for caregivers. A caregiver can have 5 patients, and he can possess, or they can possess, 12.5 ounces of marijuana. Another part of that law is...
How do you become a caregiver? Can I be a caregiver?
You can be a caregiver.
So anybody can be a caregiver?
You can't have a criminal record, can't be a convicted felon. You have to register with the state as a caregiver, and then you are then able to become one and have 5 patients. Those 5 patients then are allowed 12 marijuana plants apiece. You as a caregiver could grow 60 plants on their behalf. Also, you'd be allowed to charge them a user fee of some kind. Now, the numbers are very precise. It's 2.5 ounces of marijuana, 5 plants. That's under the state law. I want to point out, though, that the federal law makes all marijuana illegal.
Right.
And that there is a certain trivialization. I like the word trivialization of marijuana. It's alcohol and tobacco are very bad things, but that same concept doesn't translate to marijuana. We have a smoked product. There are 400 different substances and compounds within smoked marijuana. Only one of them has ever been proven to have any medical value, and that's THC. The rest are carcinogenic and other bad things that occur. There is no known medicine that's smoked that I know of. There have been studies over the last 40 years on marijuana and its application to the medical sciences. I think one of the things that stands out in my mind is that have we as a society said that medical science can't deal with our pain and ailments, that we have to now go to an illegal product, marijuana, to use, which historically has been frowned upon. Historically,
right.
In ancient history even, there are comments about the problems with marijuana.
Well, you know, on the local level, I'm sure you're aware that in most cities, and Warren included, we're certainly concerned about the abuse as far as caregivers. I mean, it's easy to say that, you know, you can have a certain amount, you can have so many patients, but I'm sure that we're going to see in the very near future, if not already in some cities, people violating the law, and it's going to be very difficult to enforce. Would you agree with that, Craig?
Yes, Commissioner. One of my biggest concerns with the whole issue is that the message that we're giving our children. Mm-hmm. I mean, we're continually telling our children, don't smoke cigarettes, don't smoke marijuana, don't use drugs. And yet now in the state of Michigan, we have a law that says basically marijuana is medicinal. And I think that's a confusing message for our children. They shouldn't be hearing that marijuana is medicinal. And I think that's a major concern.
And then we're looking at quite frankly, the city of Detroit that has enough signatures on the petition to put it on the ballot to vote on legalizing marijuana, which the three of us are certainly aware of is a gateway drug to other drugs.
That legalization issue in Detroit is going to be a very difficult thing because no matter what Detroit does, marijuana is going to stay illegal under federal law, international treaties, and a number of other good reasons. One of the things about the experiences that have been had in other states, for example, in Alaska was very liberal. They passed medical marijuana, and what they found out is that marijuana use among the younger people increased by 50% because of availability.
50%.
50% because of availability of marijuana. Once these caregivers and growing plots are established, it becomes available. As a result, that law has been rescinded in Alaska. In California, there are infinite number of anecdotal stories about crimes that have occurred, crimes of violence, robberies, robbery of caregivers, robbery of distribution locations, which is another issue. There's a movement here in the state of Michigan to try to isolate that type of activity to a certain part of various cities. Once that happens, they become targets for robberies because of the money they generate and things of that nature. The other thing that
before we go any further, because we may run out of time here, let's make it real clear to our viewing audience that we're after the drug dealers. We're certainly not using our resources as far as people that are addicted. Those people that are addicted to drugs, that's a disease, and they have to have treatment for that. But our primary concern right now is the enforcement, and we've done a great job as far as enforcement. But we also are concerned about the health, being somewhat compassionate people, which we are, that we are concerned about the young people in this country, in this region.
Well, that's absolutely true. One of the misconceptions out there is that policemen are out there arresting sick people because they're smoking marijuana. That's not true.
Very good.
In the commission of a crime, many times you'll find out a bank robber, is also a marijuana user, an illegal marijuana user. Well, that gives the impression, well, you arrested him for marijuana use. No, he was arrested for another crime, and that was just an ancillary part of it. And the other thing is that whenever you find marijuana use involved, it has some effect on that person. It has some effect on them that may be a causal effect for them to go out and do a home burglary because they wanted to get money to get more, or things of that nature. There's no one that I know of that's ever arrested a chronically ill person with terminal cancer because they smoked marijuana. There are threshold numbers. What we're after is people who distribute,
right,
cultivate. So there is not a law enforcement effort, and I doubt seriously if there will be any freedom of law enforcement to do other things, because we are concentrating in the areas where we should concentrate on, not doing trivial things such as arresting.
Okay. Gentlemen, we have less than a minute to go, so I'd like you to both, give us a closing statement as far as in the area of be it medical marijuana or drugs itself. We'll start with the Deputy Director Summers.
I think, as I said before, my biggest concern is the message we're giving to our children. Medical science should be telling us if medical marijuana is actually a medicinal thing. Medical science should be telling us that. Our doctors should be telling us that. They should be pushing for it, not the type of people that are. I have a problem with what's happening in the message on the street, and it's contradictory to what we've been telling our children for some time.
Very good. Director Azzam?
My closing message is if you're leaving on a vacation tomorrow with your family and you're going to take an airplane flight, do you want the pilot of that airplane to have used some medical marijuana before he takes you on your vacation?
Thank you. Gentlemen, thank you for being on Police Journal today, and thank you for viewing Police Journal, and until next time.